well, we're in the thick of the summer. People are out, people are active, people are trying to figure out ways to live a healthy lifestyle, to get that physical activity in while the gyms are still closed and driving everyone nuts. But some people maybe need to take some extra precautions to keep their body safe, and many people may be getting injured and avoiding going to a doctor out of concerns. And joining us now to ease those concerns is an orthopedic surgeon and sports medicine doctor at Lederman-Kwartowitz Center for Orthopedics and Sports Medicine. Dr. Ronald Lederman joins us once again on the Oakland County MegaCast. Dr. Lederman, thank you for being with us today.
Oh, pleasure to be here. Thank you for having me back.
We appreciate having you on since we last spoke. How are you doing? How's your team doing at Lederman-Kwartowitz?
Our team is doing fantastic, and patients are coming in more frequently, or I should say more and more patients. We're not up to 100%, but I mentioned earlier that at Lederman-Kwartowitz Center for Orthopedics, we stayed open even when most practices completely shut their doors, and we went to great lengths to ensure the safety of our staff and our patients. And so we're used to seeing patients. Everybody is mandated to wear a mask. We are sterilizing the office before and after each patient with hospital-grade cleaning equipment. And our whole goal was to stay open to prevent people from having to go to the hospital and the emergency room where there were more serious things required there. And they were able to come to our office for their sports injuries, for their broken ankles or wrists, or inflamed arthritic joints. And our goal was to minimize the burden on the hospital systems.
Dr. Lederman, yesterday we spoke with a couple of other doctors in the local area, Dr. David Donaldson from Beaumont Troy ER, Dr. Manu Malhotra from Henry Ford West Bloomfield, about concerns that people have had in the past throughout this pandemic, and even some recently, about going and getting treated by their doctor, going to the hospital because they're afraid of catching the coronavirus in the process, and some of the negative effects that can have down the line if you're not getting these issues treated as soon as possible. In terms of orthopedics and sports medicine, there have been people that have been apprehensive maybe to go to the doctor. Have you been seeing, as they are coming back now and have delayed getting treated on some of those issues, that those have those lingering effects that maybe people should be cautious about when they maybe are apprehensive to go see the doctor?
That's a great point, and thank you for bringing that up. If somebody has hurt themselves and within a day or two it's not feeling much better after they've done the typical Tylenol or Advil and ice and resting it, then yes, you'd want to get evaluated. We have availability every day, all day. We're in the Lakes Medical Center in West Bloomfield. We have patients that will come to us from all over Southeast Michigan. And the important reason to be seen is that a more serious problem is not missed or overlooked or ignored, whether it be a stress fracture or a torn ligament, or for somebody who has arthritis and the joint is severely inflamed because they might have gone out and overdone it, then you can jump on it. And the sooner you can get to an acute injury or an acute inflammation, the better chance you have of getting it under control quickly.
What are some complications that can arise from not getting those injuries treated quickly? If people continue to put stress on those muscles and those ligaments and those joints because they're feeling a little bit of pain, but it's not a major amount of pain, and they don't want to go see the doctor or take that time to get that checked out.
Right. Well, I can tell you that patients that have admitted to me and all of my colleagues, Dr. Kwartowitz, Dr. O'Keefe, Dr. Hyman, we have many doctors in the practice, and even our physical therapists, they say, if I wish I had come in sooner because I was so fearful of going to a doctor's office, but we set up a screening table outside of our office in the lobby of the Lakes Medical Center. And there we take temperatures on patients. We provide masks and gloves and the screening questionnaire. And once they come into the office where everything is spread out and we're able to physically distance, they feel so much better and they wish they had come sooner. To answer your question, if you miss a torn ligament, say in your ankle, and you continue to go out there walking on the trail or trying to jog, you can have a second injury that ends up being worse. If somebody has a stress fracture, it's better to shut things down and rest it for a short period of time than for that fracture to go undiagnosed and then they're 2-3 months down the road and still hobbling. A good example is someone who did have a non-displaced broken bone in the ankle. They thought it was an ankle sprain, but by the time we saw them 2-3 months later, the bone started healing in the wrong position. So those are the kind of things you want to avoid.
Is there a way to provide some of your physical therapy services or other therapies via the internet or Zoom like we're seeing at other hospitals and with other doctors?
Yes, and I never thought physical therapy could be offered virtually, but it can be. And we're actually looking into new technologies that can use some of the great technology with the Google glasses and the virtual realities to be able to provide that at a whole other level. But for right now, the patients that have come to me and said that they had Zoom virtual physical therapy, and our therapist would spend an hour with them going through different exercises and maneuvers and explaining to them how to do it correctly. I was amazed, as were the patients, at how much better they felt. So fortunately at Lederman-Kwartowitz, we do offer virtual physical therapy, but we've expanded the therapy department. We've spread out the areas where we can work with our patients, and they seem to be, at least most, 95% are very comfortable coming in and getting the hands-on therapy. But yes, we can provide virtual physical therapy. Whoever thought that?
Dr. Lederman, people are getting back outside more often now. We're in the thick of the summer. They've been out there running, playing basketball, lifting weights outside, and playing on the playgrounds, whatever they may be doing to get physical activity and stay active during these summer months. And some people are even engaging in in-home workouts for the first time, as gyms have remained closed in the state of Michigan. At your office in particular, what are you seeing or what are you hearing from your colleagues in the field in terms of potential injuries that people are developing when they are engaging in these programs, maybe for the first time, not going at the right pace, not practicing proper form, and what can people at home be cautious of to prevent these common injuries?
The rule of that whole scenario is to take it slow. I mean, how about this weather? It's magnificent. We've had 80-degree and sunshine weather for a month, 2 months, and everybody wants to be outside. And who thinks they can hurt themselves walking? But if somebody goes from sedentary after getting through our wonderful Michigan winters and has this weather where they can be outside for hours at a time and walk or jog, you end up with these overuse syndromes, meaning tendonitis, inflamed joints, heel pain, back pain, all of the different joints in your body if you jump into it too aggressively. So if people are starting to hurt because they're out there with these overuse syndromes, it's actually a good time to come in, get evaluated, make sure it's nothing serious, which it usually isn't. It often does not require surgery. And I will tell you that another reason patients are afraid to go to an orthopedic surgeon's office is because they're afraid the minute they walk through the door, it means they're going to be signed up for surgery. We're actually quite the opposite. We do everything we can to keep our patients out of the OR, out of the operating room. But come in, get evaluated. Sometimes we'll have our physical therapists work with our patients just once or twice, show them the proper form so they can get back out there and enjoy what they're doing. But absolutely, we're seeing overuse issues. We're seeing less severe violent injuries from the high school and college organized sports like football and baseball. But a lot of kids are out there. I ride my bike almost every day, and I'm going through different parks, and you see the baseball fields where the community baseball programs are in full swing, pardon the pun. And these kids are out there playing baseball, little league, and so we're still seeing those injuries.
Dr. Ronald Lederman with us. He's an orthopedic surgeon and sports medicine doctor at Lederman-Kwartowitz Center for Orthopedics and Sports Medicine in West Bloomfield. So you mentioned sports at various levels, from amateur and youth to professional sports, and these times we're in, sports are experiencing a bit of a start and stop because of the coronavirus, keeping those precautions in place. We've seen in situations like in Major League Baseball, the Miami Marlins had to shut down a game because of a coronavirus outbreak. Michigan State's football team has shut down practices for multiple weeks as they've had positive cases on their team is the start and stop of their training. And in some cases like football, where high school teams are maybe not getting physical just yet, in an abundance of caution, could that start and stop motion and that tenderness in training, when you do get back into full game action, are you expecting to see more injuries in the fall from high school and middle school sports and even professional sports because of the times we're in, the circumstances that we're in surrounding training and physical activity while preventing the coronavirus?
Yes, I do anticipate seeing more injuries. It'll be very curious to see when the NBA starts, how many of these players are going to end up with meniscus tears in their knees or Achilles tendon ruptures. In football, I think that, football's a violent sport, obviously, but there's something about practices, game preparation, and like you said, if they're not going along their normal protocol, on one hand, you can argue that there'll be less wear and tear, at least at the professional level, but I anticipate seeing more injuries.
Dr. Lederman, just another couple minutes with you before we have to let you go. Anything else that you feel would be important for us to touch on with you today, or anything else that you'd like to say before we say goodbye?
Well, yes, I do want to mention a critical segment of our population is the elderly, and how, age is just a number. But I think about our patients that are, and I'm getting right there, between 60 and 95. And the patients that live in either community retirement centers, nursing homes, these are the people that have been petrified to come in, to go to a doctor's office. And when we see them, they are so thankful that they can be seen safely and that they can be rendered the treatment that they've been putting off and therefore living in unnecessary pain. So we've talked a lot about sports, a lot about the middle school, high schoolers, the college athletes, the professional athletes, people like you and I who might want to get out there, the weekend warriors. But our aging population that might have normal wear and tear or arthritis or have a history of shoulder, knee, ankle, neck, and back issues, they don't have to be afraid to come in, because we can help make them feel better between our physical therapy or our regenerative stem cell PRP program, laser treatments, all of these things that can be offered to these patients without undergoing surgery and without having to worry about going to a hospital or anywhere else for surgery. So that's important. Let people know who are really afraid to leave their home that they can feel comfortable coming to us and be treated. And our whole motto is we get people better faster. And we do it often without surgery.
Dr. Lederman, thank you very much for being with us today.
Thank you.
Appreciate it. Dr. Ronald Lederman from Lederman-Kwartowitz Orthopedics and Sports Medicine with us on the Oakland County Megacast.